randomized studies show that women who initiate HRT within 10 years of the onset of menopause, generally before the age of 60, have a reduction in all-cause mortality and fractures. Women may also reduce their risk of cardiovascular disease by as much as 50%, Alzheimer's disease by 35%, bone fractures by 50 to 60%. Though the starting time of HRT and duration of use are decisions made between doctors and patients, the FDA's label recommendation will be to start HRT within 10 years of menopause onset or before 60 years of age for systemic HRT. This is so we get the most out of the hormones. That does not mean that if you're over 60 or if it's been 10 years that you can't use HRT. This is a message for doctors and patients alike. This is for immediate release. It was released on November 10th, 2025. HHS announced the historic action to restore gold standard science to women's health. After more than 2 decades of fear and misinformation surrounding HRT, hormone replacement therapy, the U.S. Food and Drug Administration is initiating the removal of black box warnings from HRT products for menopause. They should have never been there anyway. RFK Jr., our HHS Secretary and FDA Commissioner, Marty Makary, sorry if I'm pronouncing that wrong, made the announcement at a press conference at HHS with more than 200 people in attendance. So women have used HRT products for decades to relieve menopause symptoms. However, their use plummeted in the early 2000s, and I remember this, when the FDA applied boxed warnings following a Women's Health Initiative study that found a statistically non-significant increase in the risk of breast cancer diagnosis. So the FDA has initiated the removal of these warnings following a comprehensive review of scientific literature, an expert panel in July, and a public comment period. The agency is working with companies to update language in a product labeling to remove references to risks of cardiovascular disease, breast cancer, and probable dementia, because the opposite is true. So we stand up for every woman who has symptoms of menopause, is looking to know her options, receive potentially life-changing treatment. For more than 2 decades, bad science and bureaucratic inertia have resulted in women and doctors having an incomplete view of HRT. This is straight from the U.S. Food and Drug Administration. I will screenshot it and link it. Or I'll put it as my background. I'll green screen it. Comment to me. Tell me, has your doctor initiated HRT treatment for your menopausal and perimenopausal symptoms, or have they denied you care? I want to encourage you, if they're denying you care, to pull up this study and show it to them, because likely they just don't know yet. All right, let me know how you're doing.